Hi everyone, I'm here with Dr. Nario of Biointegrative Health Center. Thanks for being with us, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Yeah, so if you guys don't know, one of the things they do at Biointegrative Health Center is they do different IV drips, all kinds of different things. You can check out what they do online at their website, Biointegrative Health Center. It's you should be able to find it. It's pretty easy. So let's talk about arthritis. That's something fairly common. What is arthritis?
Well, Steve, this is something common that I always see, not only in higher age groups. I don't want to use older. I get bashed about it. But yeah, higher age groups, but not only that, also with younger ones. So there are different types of arthritis, and we will discuss that as we go along. Arthritis is basically the swelling and tenderness of one or more joints in your body. The main symptoms of arthritis are, of course, joint pain and stiffness, swelling, redness, decreased range of motion. I mean, not always, but these are the most common ones, which typically worsen, as we say, aging, right? And again, that's just basically talking about the most common definition of arthritis. Again, the most common types of arthritis are, as we hear every day, gout, osteoarthritis, and even rheumatoid arthritis.
Okay, so that's interesting that you mentioned age. So I'm assuming, just from being a person on Earth, that the older you are, the more arthritis would affect you. But you also mentioned younger people. So can you tell me a little bit about what causes arthritis and what causes it in older people? And I'm interested to know what causes it in younger people.
Right. So that's why, Steve, I want to break that stereotype that arthritis is only for older people or mature people. So here's for example, the most common one that we always know is osteoarthritis, and this is caused by cartilage that is usually, as we know, it's like the cushion in our joints, and it's slippery and actually brings lubrication to the joints. Then what happens here as we age, it breaks down. And that's why when it breaks down, because of wear and tear most of the time. That's why this is the one that we commonly affiliate with age. And when you talk about, of course, non-age specific, when you mention about, okay, age, is it always supposed to be a factor for arthritis? No. What about rheumatoid arthritis? This is also the destruction of the joints, but it is now because of your immune system attacking your own joints, thus destroying it. So this usually does happen in the older age group, but this is one that is not wear and tear. But this is the one that's actually your body actually destroying your own joints. Another one that you see a lot with younger individuals would be uric acid or gout crystals that accumulates in the joints. And again, this is just too much uric acid in the blood, and it accumulates in these specific, like the big toe. And I know everybody probably heard of that. It's just like the most excruciating pain ever experienced by a person. And other less common causes like infections, lupus, psoriasis, and those are very, I guess, minimal in terms of contribution to the general population.
So I'm assuming that maybe diet could be somewhat more effective if diet's really improved for the younger people, but maybe for the mature, as you put them, how can diet affect this?
So the diet, that is pretty big, Steve. If you think about it, joints and food, not related. It is related. For example, osteoarthritis. Again, we spoke about the cartilage. It breaks down. This is really related more on when you talk about weight, right? So the more weight you actually have, the more pressure, the more stress on your joints, especially the lower extremity joints. That's why when we talk about osteoarthritis, we actually need to lower down carbs. We need to lower down fat intake. This is in general, all right, to lower down weight. Another one is rheumatoid arthritis. So rheumatoid arthritis, this is actually now your immune system. And in every condition that I actually see, regardless of whatever autoimmune disease that is, gluten and dairy free, always the best way to go. Majority of these autoimmune patients as well, we call destroyed guts or destroyed gut linings. That's why when these types of food choices that I just mentioned enters your body, this stimulates your immune system in a bad way, thus affecting the destruction of more joints in the system. And lastly, uric acid, which is gout. As we all know, gout is always related to possibly what we call eating a lot of DNA-based foods, because uric acid is part of the DNA. It's the purines, as we call them. And this is mostly found in animal sources. So that's why lowering down that type of diet actually will help relapse or flare-ups of gout attacks.
Okay, so I know you do a lot of treatments there at the clinic that are for inflammation, but what are some of the specific ones that you have your patients do at the clinic? What treatments?
Well, Steve, for arthritis, of course, being a conventional doc, I always still entertain or hear from patients about the conventional ones like NSAIDs, like ibuprofen, naproxen, Advil, and these are what we call NSAIDs. Again, not a big fan because of stomach irritation, the risks of heart attacks and strokes increase. And there are also topical forms of this so you can buy over the counter and rub it on your joints. Another one would be the menthols, the capsaicin, the Bengay. And usually these are the ones that what we call counter irritants that actually rubs on the skin to kind of negate the pain signals. And you will hear steroids. These are now the heavier guns for arthritis. And of course, these are the ones that can be injected, can be orally taken in. And the thing there is side effects again, thinning of bones, weight gain, and DMARDs. You'll hear that. This is now the immunosuppressive drugs for rheumatoid arthritis, which has a lot of side effects, including increasing infection. I'm a big fan of more of conservative, like physical therapy. I'm actually good with that. That's something that actually strengthens not only the joints, but also the muscles and also the ligaments and tendons. Surgery, sure, that's kind of be the worst case scenario. But on our end here in Biointegrative, we actually have integrative measures. For example, perlotherapy. Perlotherapy is we do injections on specific joints, and we inject ozones, B12, procaine, homeopathic remedies in specific joints to actually lower down inflammation. Also for systemic therapy, we have IV-DMSO. IV-DMSO is a sulfur-based therapy that actually is an anti-inflammatory. Initially used on animals, but now there are human versions of this. It just makes you smell like garlic or oniony, unfortunately. And the best one that I've seen so far in my practice that helps with generalized pain or single pain or joint pain is the ozone UVBI or EBU therapy. This is actually the one that removes blood out of your system and cleans it out and lowers down the immune inflammatory markers that actually aggravates pain. One of the fastest ones I've seen. I mean, I really was astounded by this device. And also, being conventional, again, we do have Toradol, which is an anti-inflammatory, non-steroidal also that we do injections on, and of course steroids, but we use this in very severe cases, but still always going for the natural ways or different natural approach as my first step.
Yeah, the EBU is a good one. And I've heard that a lot of people, it gets rid of pain everywhere. That's a common one. That's where I've done that treatment. It's where you take the blood out and you treat it and then you put it back in. But yeah, that's a good one. So thanks for your insight, Dr. Nario, on arthritis. You guys can find out more about the clinic, Biointegrative Health Center, online. Thanks for being with us.
Thank you, Steve, and thank you for having me again. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.